Hello viewers, welcome to Island Health View, a program designed to bring you matters relating to health in Dominica. I am your presenter, Rima Alfred. This program is being brought to you on Digicel Play TV, Channel 3, this and every Friday. On this episode, we'll take a look at diseases spread by mosquitoes, specifically the Aedes Aegypti mosquito, which has been affecting us here in Dominica. More on this when we come back. Stay with us.
Wash your hands. I am Adora Tuse, health educator from the Ministry of Health. Proper hand washing protects against the spread of many common illnesses and germs. Wash your hands often with soap and water, or you may use a hand sanitizer. Remember, clean hands save lives. Protect yourself.
A message from the Health Promotion of the Ministry of Health.
Welcome back. Millions of people around the world have been affected by mosquito spread diseases. Chikungunya is a viral disease transmitted to humans by infected mosquitoes, namely the Aedes aegypti mosquito. It causes fever, severe joint pain, muscle pain, headache, nausea, fatigue, and rash. Joint pain associated with chikungunya is often described as debilitating and can vary in duration. Another mosquito-spread virus is dengue, which is also known as brick-borne fever, and is a mosquito-borne tropical disease caused by the dengue virus. Symptoms include fever, headache, muscle and joint pains, and a characteristic skin rash that is similar to measles. Though chikungunya and dengue are quite similar in terms of symptoms and treatment, dengue comes with complications which tend to be life-threatening. In rare cases, the disease develops into the life-threatening dengue hemorrhagic fever, which results in bleeding, low levels of blood platelets, and blood plasma leakage. Patients could also develop dengue shock syndrome, where dangerously low blood pressure occurs. Senior medical student Dr. Nariska Henderson gave us some details on the dengue virus and how it is born and spread to humans.
Dengue virus is caused by the Aedes aegypti mosquito, and like my colleague said earlier, it's a vector-borne disease, meaning that it's caused by a vector, it's transmitted by a vector, which is the Aedes aegypti mosquito. Now, what do you look for, right? We know, well, most Dominicans, so to speak, will have known what the Aedes aegypti mosquito looks like. But it's a mosquito with a white tag, so to speak, a white stripe on it. So it's striped, it's black and white in color, that's the legs. The dengue virus is also known as brick-borne fever. So one of the early symptoms of dengue virus is fever, a very high fever. Also, you would see things like rashes, right? So, very high fever, rashes, muscle pains and joint pains, which are very common with dengue fever. Dengue, since it's caused by a virus, there is no treatment for viruses. However, the symptoms could be treated. Like the rashes, it causes itching, so you could use something to relieve the itch, right? Like hydrocortisone cream. The arthalgia and the myalgia, which are joint pains and muscle pains, it could be relieved by drugs such as paracetamol, which could also take care of the fever. Okay, fever also causes a decrease, or it, so to speak, causes you to become dehydrated. So you would like to increase your fluid intake. So you'd like to drink a lot of water. In drinking a lot of water, it also helps to flush all the virus from your system. If the disease is not well taken care of or well treated, it could cause what is known as dengue hemorrhagic fever. That's where you experience internal bleeding, which could lead to death. Okay, so it's very wise of a patient or person to treat the disease as soon as they get the symptoms.
Thank you.
Hey, Carmen.
Hey, Brianna.
What's wrong with your face?
Harold is sick.
Harold?
Yep, Harold, my friend.
What's wrong with him?
I don't know, he started complaining of fever, of backache, of headache, of muscle pain. He feels like he wants to vomit. If I didn't know better, I think Harold was pregnant.
Pregnant?
I'm just joking. He has chills, he has pains all over. You know, I also saw a rash right on his foot.
A rash, you say? Really?
You know what the worst part is? He has joint pains and he feels like he has arthritis. Harold cannot even put on his clothes.
Whoa.
Whoa.
That's bad.
Serious.
Well, you know what I think?
Tell me.
I think Harold may have chikungunya.
Chick? No. He doesn't have gope. He just has muscle pain.
No, I didn't tell you about a chick or gope.
You said chick.
I said chikungunya.
Oh.
That's the new viral disease that's in Dominica right now.
Huh.
It's almost like dengue fever. However, it's not dengue fever.
So hold on, that means it's a mosquito disease?
Yeah, it is, indeed. I heard the health officials talking about it on the radio. That's how I know.
You know, if you heard it on the radio, we need to go see the environmental health officer because Jim Jones and I, we sleep in the same room. And Harold is not giving me any chikungunya disease.
Well, I think we should go now.
I think so too.
Hi, I am Zilma Charles, Environmental Health Officer. The best way to prevent chikungunya virus infection is to avoid mosquito bites. This will help to prevent further spread of the virus. In order to prevent mosquito bites, you should wear long-sleeve shirts and long pants. Use mosquito repellents such as citronella oils or cream or insect repellent sprays. You could also use mosquito coils and vape mat, but pay attention to how you use the coil so that you don't cause a fire by accident. Cover with mosquito nets while you are sleeping. Avoid visiting your friends' homes if they are sick with the chikungunya virus. If possible, avoid going to areas where the disease is present. Stay in air-conditioned or cool areas if possible. Mosquitoes do not like cold temperatures. Keep your environment clean and do not store water around the house. If you must, then make sure that the container is covered so that mosquitoes don't get in to breed. Remember, your health is your responsibility.
Welcome back. As earlier mentioned, chikungunya is a virus spread by the Aedes aegypti mosquito. The Island Healthview team also spoke to another senior medical student from the All Saints University, Dr. Yudi Ferrara, who gave us an insight into the chikungunya virus.
Chikungunya is a viral disease which is spread by the Aedes aegypti mosquito, right? And it's mainly spread when an infected mosquito bites a human, and from there it manifests in the body, right? Between 3 to 10 days incubation period. Symptoms include, weakness, fatigue, joint pain, muscle aches, right? Dehydration, fever, and it's quite similar to dengue in terms of symptoms, but it lacks the hemorrhagic effect, like the internal bleeding effect. It's mainly spread, like I said, through mosquitoes, and one way you can control it is by getting rid of the vector. It gets infected with the virus, but it doesn't have any, how can I say, effects on the mosquito itself, right? So the mosquito, it gets infected, but it carries on its life like, daily life without showing any manifestations, right? So it does not affect the mosquito like it affects the humans. But as time goes by and the disease, the virus replicates in the mosquito, then it bites a human and introduces that virus into the bloodstream. From then, it multiplies, and then you have the manifestations of chikungunya virus. which is what I stated earlier, which is the joint pains, the backache, headache, fatigue, tiredness.
The Island Healthview team also spoke to the District Medical Officer and Team Lead of the Roseau Health District, Dr. Lenora Favre-Trigo, who spoke to us about the disadvantages of dengue and chikungunya and what we should do to prevent continuous breeding of mosquitoes.
The resurgence of the chikungunya virus and the dengue virus are of public concern to us as a Ministry of Health, and not just to us as a Ministry of Health, but it should be to employers as well, because we all remember that during the last outbreak of chikungunya, many companies were affected in having to pay out monies to their staff and having so many employees missing work because of the illness. And it's not something that you can come to work with, you need to stay home and rest. So it is of public concern to us. Last year, we had this myth going around that the virus, the chikungunya virus especially, was not caused by a mosquito, and it was just a plot on the part of the Ministry of Health to get people to clean up their environments. But I want to reiterate that it is a vector-borne virus. Both the dengue and the chikungunya virus are spread by the Aedes aegypti mosquito. And in saying so, I would like to emphasize the need to keep our environments clean. So we would go back to basics. You get rid of all water sources that are stagnant, cover your drums if you need to keep water stored for whatever reasons. If you don't need to keep it stored, please turn them over. And keep your environment clean. You use mosquito nets, you use citronella, you use bay oil, you use sprays. So there are ways of protecting yourself from the viruses. The Ministry of Health came under some fire last year saying that we were not prepared to deal with the chikungunya virus. That being said, I would like to emphasize again that the onus is on us as a public, as individuals, as families, to keep your family and your environment safe. And if everybody takes that responsibility on for themselves, then your community will stay safe, and in so doing, keep the entire island safe. We've heard about a new virus which is caused by the exact same mosquito. It's called the Zika virus, and it came out on the airwaves. I've seen it in public media, on social media. The Ministry of Health has not issued a statement vice this new virus which has come out, so it would be remiss of me right now to give any sort of information. I can say this though, that it is another vector-borne virus. It is the exact same mosquito, so therefore the ways of protecting yourselves against the Zika virus, the dengue virus, or the chikungunya virus remain the same. Control the vector, stay mosquito free, and we will remain healthy.
Before we end, here's what you can do to control mosquito breeding. It's been said that there are certain plants which contain natural oils which repel mosquitoes. Having them in your home or crushing the leaves to release the aroma or rub on your skin will decrease the amount of mosquitoes that are attracted to you and your family. These plants are lemon balm, catnip, basil, lavender, peppermint, sage, rosemary, and citrusum. So go ahead and start your garden. Beautify your home while protecting your family. And now, stay tuned for the new Beauty on a Budget with your host, JL Joseph.
Welcome to another episode of Beauty and a Budget. In this episode, we are going to be discussing a few tips for persons, especially those of you who are diabetic and looking for a fantastic pedicure this summer. Now, it's almost summer and everyone wants sandal-wearing feet. Are you a diabetic and the first time doing a pedicure? Here are a few things to note before, during, and after a pedicure. Ask about cleaning procedures. Call ahead or stop in to ask the manager how the salon is sanitized. Ensure they treat their tools like medical equipment. Every salon should follow 3 simple rules: sanitize, disinfect, and sterilize. Disinfection uses antimicrobial agents on non-living objects or surfaces to destroy or inactivate microorganisms. Disinfectants may not kill all bacteria, viruses, fungi, or even spores. Most disinfectants are weakened or inactivated by organic matter such as dirt and feces. Sanitation uses an antimicrobial agent on objects, surfaces, or living tissue to reduce the number of disease-causing organisms to non-threatening levels. Sanitizing does not affect some spores and viruses. A practical method of sanitizing hands is to wash them with soap under running water, that's running hot water, for at least 20 seconds. Sterilization is using chemicals, temperature, gas, and/or pressure to kill or inactivate all disease-causing bacteria, spores, fungi, and viruses. Now, if you can't find a salon that takes simple precautions, consider providing your own tools. Before you schedule a pedicure, check with your physician to make sure it's okay to have one. Once you have the green light, do your feet a favor and learn how to look for and what to avoid at nail salons. Taking a few basic precautions can significantly reduce infection risk and lead to a safer, more pleasant experience. Know when to postpone a pedicure. If you're currently having any infections, cuts, or open sores on your legs, feet, or toenails, skip the salon since this will make you even more vulnerable to problems. Instead, contact your physicians for a referral to a podiatrist or other professional who is medically trained to care for feet. Avoid shaving your legs for a day or two before your pedicure. Shaving can leave tiny nicks in your skin, even if you can't see them, and increase the chance of an infection. It's fine to shave afterward. Stick with a salon that is clean and practices impeccable sanitation. Tell the manager you have diabetes and ask about their sterilization procedures. Reputable salons will be more than happy to show you how they operate. Food baths should be cleaned and disinfected between clients. Clippers and other tools should be washed and sanitized in a disinfecting solution. Better yet, invest in your own nail kit and bring it with you. Though it's unlikely that you will get an infection from shared nail polish, play it safe and bring your own. Make a morning appointment. If you can, schedule your appointment early in the day so that you are one of the first customers. Let your technician know you have diabetes before the pedicure begins. Ask him or her to be very gentle and to avoid doing anything that can scratch or injure the skin. Don't hesitate to speak up if you don't like what the technician is doing. Your health is too important. Keep the technician informed of protective practices. Ask the technician not to cut the nails too short, as this can encourage ingrown toenails and lead to an infection. Make sure toenail edges are not sharp. They should be rounded off with a file. Skip any services that can injure the skin. Never allow the technician to cut your cuticles or to use any sharp instruments on your skin or under your toenails. Instead, after your feet have been soaking for a few minutes and the skin around your toes is soft, cuticles can be gently pushed back with an orange stick. Request gentle pampering. Pumice stones or abrasive tools are okay for calluses and rough areas, but ask the technician to be very gentle. Vigorous scrubbing is not necessary and can easily scratch or leave microscopic tears in the skin, making you more susceptible to infection. After your pedicure is finished, keep an eye on your feet and legs for any signs of redness or infection. If you notice anything unusual, call your doctor right away. And this episode was, of course, for those of you who have diabetes and you're looking for that sandal feet for the summer. Thanks again for listening to Beauty on a Budget. My name is JL Joseph. Good day.
And that's all, folks, for this edition of Island Health View. Be sure to join us next Friday for another edition. Until then, I am your presenter, Rima Alfred. Thanks for watching.